According to the Centers of Disease Control and Prevention, 61 million adults are living with a disability in the United States today. That translates to 1 in every 4 adults. A disability can be defined as any condition of the body or mind that makes it more difficult for the person living with the disability to do certain activities or interact with the world around them. As you can imagine, living with a disability can bring along some special healthcare needs. This includes any physical, developmental, mental, sensory, behavioral, cognitive, or emotional disability that requires health care or services of a quantity or type beyond that of the usual requirement. Adults with disabilities are more likely to be inactive, have heart disease, diabetes, be obese, and smoke. 1 in every 3 adults with a disability does not have a healthcare provider, and 1 in every 4 has not gone in for routine healthcare checkups within the last year. Like their adult counterparts, children with special healthcare needs are less likely to have access to healthcare providers, especially oral healthcare, and are less likely to visit the dentist than their age-matched counterparts. According to the National Institute of Health, persons with developmental disabilities have a higher risk of tooth decay, gum disease, malocclusion, oral malformations, damaging oral habits such as grinding or clenching, trauma, and injury. Overall, people with disabilities have poor oral health and poor oral hygiene. Now, you may be thinking, or hopefully I have you thinking, well, why is this? Barriers to dental care for adults and children with disabilities include, but are not limited to, finances, such as health insurance benefits, difficulty with self-care, especially when it comes to personal oral hygiene, limited availability of appropriately equipped dental clinics, and lack of appropriately trained dental providers. Fewer than 10% of dentists treat patients with disabilities, yet they make up 25% of our population. And this is the problem I'm here to bring attention to today. This year, the theme of TEDxUConnFarmington is unfolding the unknown. And when it comes to dentistry and people with disabilities, the unknown is what is keeping such a large portion of our patient population from receiving oral care. The majority of providers, including physicians, dentists, and nurses, do not feel comfortable treating patients with special healthcare needs, since so many of them don't have any prior experience or training in providing for patients with special needs. So how can we change this? In July of 2020, the Commission of Dental Accreditation passed a standard that now requires robust training by dental schools in treating patients with intellectual and physical disabilities. This was a huge step in the right direction. Studies have shown that students trained to treat patients with disabilities are more likely to see these patients in their future practice. But this is only the beginning, because successful and effective training modules need to be incorporated into dental curricula in order for the standard to make a difference. Currently, I am part of a research team that is working on a project for applied interprofessional education for inclusive health. In the fall of 2020, a survey was distributed to medical and dental students to understand the knowledge, perceived skills, and abilities among these health professionals. The results were not surprising. Of the respondents, a quarter had no experience working or volunteering with individuals with intellectual disabilities, and 63% had not treated a patient with an intellectual disability. A little over 80% strongly agreed that it is important to educate students about treating patients with special healthcare needs and that it should be included in the curriculum. Nearly all respondents agreed or strongly agreed that they would like to have more experience before feeling comfortable treating patients with special healthcare needs. Now, based off these results, our team decided to begin by creating a training module for one of the health professions, dental medicine. The module was designed as case-based learning scenarios taught over 4 weeks, 1 hour per week, to a focused group of dental students throughout their training. In addition to the hourly teaching sessions, the students were giving pre-reads in the form of fact sheets developed by the research team, pertinent articles, and online videos to watch. To assess student knowledge, quizzes were taken at the end of each class. Feedback was also taken from the students at the end of each week so that modifications could be made to the teaching material every single week. Although the cases were designed to represent a specific healthcare need, students were also encouraged to apply the patient management skills that they were being taught throughout these sessions to a broader scope of other special health patients. During each session, the students were invited to participate in discussion through open-ended questions about how they would proceed in managing with these patients, including, but not limited to, patient examination, treatment planning, oral hygiene and nutritional counseling and their modification for special needs patients, parental education about oral health and oral health needs for their children, pre-appointment expectations, introducing a multidisciplinary approach towards patient management, sedation services for comprehensive care, and understanding the emotional, mental, and physical challenges faced by special health care patients on a daily basis. We found their knowledge of consideration in treating patients with special health care needs significantly increased from 48.5% to 78.6% after participating in the pilot curriculum, which was statistically significant. Participants' self-reported confidence in treating patients with special health care needs also increased. Providers could be uncomfortable with the unknown, which is why it's very important we help by beginning to unfold that unknown during their training with didactic and clinical experience. Some of you might be thinking, well, I'm not a dental student or a dentist, so how is this relevant to me? I'll leave you with a couple questions to think about. How can all professions be inclusive? Do you feel comfortable providing the best care or services possible to any patient, client, or student with disabilities? What type of resources would make you feel more confident in providing care or services to this patient population? As it was best said by Verna Myers, diversity is being invited to the party. Inclusion is being asked to dance. Thank you so much for your time.